Good afternoon, everyone. This is Dr. Dale Bratzler, University Chief COVID Officer here at Oklahoma University, and we're here to give the weekly update. Today, the state had 854 new cases that were confirmed today. We have about 42,225 cases in our state that have been confirmed since the start of this pandemic. We also hit a new milestone today, 600 deaths that have been recorded in the state. Interestingly, there were 10 new deaths recorded today, and none of those occurred in long-term care. So they're people that are in the community, although most of them remain in that 65 and older age group. There have been 59 deaths in the week. So in the past 2 weeks, we've seen about 120 deaths from COVID-19, which is the highest level we'd seen in quite some time. And again, I think it reflects that we've had a big peak in the number of people with confirmed cases and also a high peak of people in the hospital, particularly those that are in the intensive care unit. There is some good news today. The 7-day rolling average for the first time in quite some time is actually trending downward. We're just over 800 new cases per day on average. Oklahoma County and Tulsa County remain the leaders in the state with the most cases. When you look at testing in the state, we're hovering still right around 10 to 10.5% of all specimens that are tested are coming back positive. That hasn't changed too much, although it has not gone up anymore for the entire state. When I look at data for Oklahoma County as an example, right now we're seeing anywhere from 15 to 16% of the tests that are being run are positive in Oklahoma County. Hospitalizations were down yesterday. It was a fairly abrupt drop, and so I question whether all of the data was reported for yesterday. But again, we had more than 200 patients in the hospital with COVID-19 that were in an intensive care unit bed. And again, as I've highlighted in multiple conferences in the past, if you have that many people in an intensive care unit bed, we're likely to see more deaths for some time. Deaths will trail behind the actual cases, so even though we're starting to see some decline in the number of new cases in the state, which is good, I think we'll continue to see deaths for some time to come until we really reduce the number of people that are hospitalized with COVID-19. There were 3 other issues I wanted to just highlight today. We'll provide a handout that highlights some of this. But there were a couple of things that came out this week that I thought were important to highlight. One was an article that came out yesterday in the journal JAMA Internal Medicine. And it was a study from South Korea that did quantitative testing for viral load in patients with symptoms and those who were asymptomatic with COVID-19. In other words, they were counting the number of viral particles that actually showed up in the testing that they did. And they found that the number of virus particles were the same whether you were symptomatic or asymptomatic. And that's a very important finding because some people have been trying to suggest that patients who are asymptomatic with this disease weren't shedding as much virus. But now we know from this particular study where they actually quantitated it, they found that the amount of virus that was being shed by people with no symptoms at all was the same as that being shed by people who had symptoms. So again, I think we know that 40% of people with this infection will remain entirely asymptomatic, but they shed the virus, they can spread the disease, and that's why you have to assume that anybody you encounter, whether they look just fine, could potentially be infected. Another thing that came up this week here on our Health Sciences Center campus, and I think is important for everybody to know, is should you be wearing a mask that has an exhale valve in it? You see them commonly. They're sold on the internet in many, many different sites. And it's a mask that has a small exhale valve on it that allows air to come out more rapidly. Some people like them because it makes it a little bit easier to exhale. And it also, if you're wearing glasses, it may reduce some of the fogging that occurs with glasses. But the problem is that air that's coming out of that exhale valve is not filtered. And so you could spread COVID-19 virus by breathing out with one of those masks that has an exhale valve. So we're looking at that very carefully here on our campus, we require anybody that's wearing one of those masks now to put a surgical type mask over that exhale valve. And I would discourage you from using those in settings where you're around other people, because you may be defeating the purpose of wearing a mask by exhaling virus through that exhale valve. And then lastly, the other question that's come up to our team this week is, what about these gaiters or buffs, these neck devices that are often worn by fishermen or people that are hiking and things to protect their neck from the sun or dust or other things that can be easily pulled up over the mouth and nose. Most of those devices are single layer, most are polyester. Most of them, if you hold them up to light, you can see light straight through it, so they're really not protecting you, and they may not filter out all particles that come out of your mouth. And so in general, if you go to even the company's websites that produce those items, they suggest that they not be used for COVID-19 prevention, and we don't recommend them as a strategy to use instead of a mask. Any face covering is going to be better than none, but they haven't been shown to be particularly effective. The companies don't support them for protection against COVID-19, and again, here in our Health Sciences Center, where we obviously are very, very concerned about transmission of this particular virus, we won't allow those to be used for people in our facilities.
Okay, good information. So since you're talking about masks most recently here, we had Channel 4 is asking about mask, updated data on mask ordinances. Are we seeing that, starting to see a downward trend of cases in cities with the mask ordinance such as Norman?
Yeah, so the question is about, are we starting to see any data that's showing that the mask mandates are starting to have an impact? And I might argue that now that we're seeing some plateauing of cases in Oklahoma, because we do have mask mandates in the two largest metropolitan areas of Oklahoma that have the most cases, that we may be starting to see some impact. And I'm aware that there are some researchers here in Oklahoma that are carefully teasing out that data of communities who have mask mandates and those that do not. Their data is too new yet to actually make specific recommendations. This morning I highlighted what's happening in our student health clinic on the Norman campus. About 4 weeks ago, about 12% of the tests that we ran on students or staff who came through that got tested were positive. That number now has dropped to less than 5%. And remember, we have a mask mandate on all university facilities, and also the city of Norman has a mask mandate. So it's not, I'm not going to sit here and say that that's proof, but it's certainly the trend that I would expect to see. As more people wear masks, the number of people who test positive should go down.
Okay, so to continue that conversation with what is expected when OU starts school back up?
Yeah, so the question is about the startup of school at OU, in particular probably moving into residence halls next week, which will start next Tuesday. So all of the students moving into university housing should have received their test kit to do an at-home COVID-19 saliva test, and we're starting to get those results now. The good news is I've seen only preliminary data, but very few students are testing positive so far, which is just absolutely great news, but again, very limited number of results that are back yet. When the students arrive on campus, there's a specific check-in process that will occur down in Lloyd Noble Center, and then from there, the students will receive all the material they need, including their key. They'll receive face masks and other things, because as we've mentioned before, to get into university facility of any type, they must be wearing a face mask. There is a team that the university has assembled that will actually help the students move into their rooms to carry things in, and then there'll be limited visitation of visitors, particularly family, one at a time, in particular to try to reduce the burden of traffic that's coming through the center. Anybody coming into one of our housing facilities must wear a mask. That will be required to come in. And again, as you know, any student that wants to move into university housing has to have a negative COVID-19 test to move in. In the classroom experience there, I think we're quite safe. Classes of more than 40 students will all be online. Classes smaller than that can be taught in person or online or in a blended format. It will depend on how the department chair for that department has actually set up arrangements with their faculty. But all of the classrooms will be physically distant, so no student will be sitting closer than 6 feet in any direction from other students, and everybody will be in a mask, including the professor and all of the students. So we've done everything we can to keep that environment as safe as possible. We've talked about before, all the surfaces will be disinfected regularly, and they've made substantial changes to the heat and air system of all of the buildings on the Norman campus to improve filtration, improve air exchanges, and reduce the risk of any infection on campus.
So just thinking through that, in general, though, more people are coming into the state right now to go to these, like Stillwater and Norman, so that means more chances of higher numbers of COVID.
Right. So we're quite aware that there are something like 25,000 students that will return to Norman as undergraduates on the Norman and graduate students on the Norman campus. So absolutely, we're concerned that we could see outbreaks. We're offering free testing to anybody that wants testing when they come on campus. That's a student, staff, or faculty. And if we have any positive cases, we are ready to immediately do contact tracing, testing of any direct contacts, and we've set up some isolation beds, particularly for those students who may live in university housing. There will be a place to house them separately so that they don't expose other students.
Can you just spend a little bit more time talking about the importance of continuing to wear your mask in public places? There's still a lot of debate and misinformation online. What should we be encouraging the public right now?
Well, still, so the question is about what should we be encouraging the public, particularly related to masks. Masks are very effective at reducing person-to-person spread of this particular disease. So it is very, very important that people continue to wear a mask. I have to say the one thing that I always am reluctant to talk about, we've plateaued or the number of cases seems to be perhaps going down now, is that people start to let their guard down. We can't do that. I mean, we're headed the right direction now, so we need people to wear masks anytime you're in a public setting. Anytime you're even outdoors, if there are other people around and you cannot physically distance from those individuals. Remember the places where people are most likely to get this infection. It's where you bring people together in an indoor space. So it may be restaurants, bars, any community setting, office settings where you have large numbers of people, particularly if they're not in mask, places of worship, any activities like that where you bring people indoors together where they're in close proximity, then you need to have everybody in a mask to reduce spread of the virus. There was a nice story this morning from, again, the Institute for Health Metrics and Evaluation. I think I've already highlighted that last week they published a study that showed that if masks were only 30% effective, only 30%, we would see a reduction by 2/3 in the number of people who would die in the United States. And this morning they put out data that suggested that if we got 95% of the population wearing a mask, we would see 70,000 fewer Americans die from this disease by the end of the year. It is the best intervention we have. We don't have a vaccine yet. There are no medicines, pills, supplements, or anything else that have been shown to prevent this disease. So we have to do what's most effective, which is, physical distancing, a mask, hand hygiene, and avoiding crowds.
What are your thoughts on Dr. Birx coming to Oklahoma or the White House Task Force recommendations for Oklahoma?
Well, so first, Dr. Birx, Deborah Birx, is a highly respected clinician, researcher, immunologist who has been instrumental for years in HIV and AIDS research. So she is a very, very competent physician, and I know that any recommendations that she makes will be based on science and evidence. She's a very, very credible person that's a part of the White House Task Force. The White House Task Force had made recommendations to a number of states that were seeing substantial outbreak in the number of cases to close certain things down like bars, certainly to consider shutting down gyms or requiring mask mandates within gyms, and then also just thinking about mask mandates, because again, we know it's one of the most effective interventions we have to prevent person-to-person spread of this particular virus. So I think the recommendations were solid. Dr. Deborah Birx is an outstanding clinician and very, very credible, and I think we all look forward to her coming and hearing her recommendations.
Excellent. I don't have any other questions. Is there anything that we want to leave us with for the weekend?
Just, another nice weekend. It's real easy to get out and get into crowds. Don't forget to wear your mask if you're going out in any outdoor or indoor setting where there are a lot of people around. Protect yourself and protect those people that are around you. Again, I highlighted multiple times now, I think wearing a mask is a small price to pay to save somebody's life.